So this session is called Engineering Your Health, and we've got an all-star panel.
We've got a healthcare system that really is dependent on technology, solving some of the major problems that we've got.
There's some really fascinating technologies coming out which are truly disruptive. Instead of having to go to a lab to get a blood test, prick your finger on a little chip and it'll give you the same data, and for $2. Real-time feedback of biometric information.
And the next step is analytics, because we've generated so much data, doctors can't use all that data, so we need to analyse it and give them something graphical. Have a wearable that they wear that disappears on their body basically, it's so comfortable. We use cellular to get it back, we analyse it to simplify it and give the clinician everything they're used to in the way they're used to seeing it. The average is 19 years from a good idea to saving a patient.
We can take information from Orion, from HealthLink, from your GP, from all of the people that are working in healthcare in New Zealand and put them in a secure web-based, cloud-based system.
The people who are still the major gatekeepers are often in the older generation, and many of them actually don't like using email. And once that next generation of both the consumer or the patient kicks in, and once that next generation of the physician or specialist kicks in, you're going to have a very different world.
If I'm a cardiologist and I measure you, and if I have video involved, I get paid as though you're in my office. I haven't driven 2 hours to your house. I'm seeing 25% more people. I'm making more money. I'm pretty motivated to use technology. I think the US is going to overtake everybody because now they've figured out how to put money in the equation.
$800 or $900 billion worth of the US expenditure is on treating preventable diseases. With respect to privacy, we're encrypted at source on the fly. It's like, almost military grade security. And then our customers get on their iPhone, take a screenshot and post it on Facebook.
I think the elephant in the room is compliance. We start with people that are really sick and really want to do something about their health. They're a patient and a customer. If you don't care, you're not a customer. These chronic diseases are complex and they're different for every person that has it. So now you need lots of orthogonal measures or lots of things to measure to give a doctor the information they need.
The cost is just skyrocketing because the integration issues are becoming so much bigger that we are having to try to unpick everything and get them working together. What we need to do is actually have a 5-year plan, a 10-year plan, and that needs to be supported by a government.
So the return on investment has to be made such that it may be a little bit more money now, but it saves you all this in 12 months' time. US, they know how to invest to make savings later.
Nothing that is this big is easy or going to be fast. But we have to keep chewing away at the elephant, so to speak. And if technology providers can be there to help support us and talk to the clinicians and the nursing staff and the patients about what they need, then we will then have those enablers to support the bigger change process that's going on.